Live now to the ACT Chief Minister Andrew Barr. Chief Minister, thanks for your time. The Federal Health Minister said that we're seeing a consolidated flattening of the curve, and I guess in the ACT it's a similar story, isn't it?
That's right, Kieran. We've had a pretty good weekend in terms of very low numbers of new cases, a couple of days without any, and then just one today. So that's obviously the right sort of data you want to be seeing, but gee, we've got a long way to go yet.
And when you say a long way to go, it's basically because while we're starting to flatten the curve, we need to see this consistently. Is the advice basically that it needs to be seen over months? Is that what we're facing here, 2 to 3 months of this sort of data?
Look, I think that's a fair assessment. I guess it depends really on what the short, medium and long-term goals are. And in the short term, it was been very much about buying time, really, for our health system to gear up, for the community to get a little bit used to physical distancing and some of the changes that are incredibly regrettable, and no one particularly enjoys life the way it is now, but the sorts of things that we have to do at the moment, we are doing pretty well. And so I think it's an opportune moment to say thank you to, in my case, the people of Canberra, but more broadly across the nation for the efforts that people have gone to slow the spread of the virus. But what it's doing is buying us time to gear up the health system. I guess every day we are a day closer to better treatments for those who get sick, and hopefully we're a day closer to a vaccine. When you think about medium-term goals, and these are the sorts of things that the National Cabinet will be discussing in the weeks ahead, it's really about how do we manage life with COVID-19, how do we gear our economy to a point that it can generate more output safely. How can we get to a point where we're comfortable with some relaxation of the current restrictions in order to have life be a little better for a lot of people, but do so whilst managing this risk. And the risk is that we don't have immunity. There's 25 million Australians who can get sick here, and potentially a lot of people really sick, and some die, and that's the thing we're balancing. I've got to say, there's no easy outcomes here. Often we are presented with a series of bad and increasingly bad potential outcomes that it's not like we've got a good choice to choose from. A lot of the time, it's the least worst we have to pick.
One of the encouraging numbers, and it's not just the ACT, but it's reflected nationally as well, as this recovered percentage. So if you look at the ACT, 103 cases, more than 70 so 3/4 basically have recovered. Federally, I think it's a bit over half have recovered. So that's encouraging. Is there a chance of eliminating COVID-19 in Australia at least?
Well, that's, I guess, is a viable medium-term goal, but in order to do that, you obviously then have to go a number of weeks without any new cases anywhere in order to get out of the incubation period and to have no potential for community transmission. And then, of course, you have to have the strictest national borders and quarantine and isolation. And even now, when we essentially have a do not travel, there are still hundreds of people who are coming and going from Australia who are undertaking what is absolutely essential work. We have to import things. We need certain industries and activities to continue. So we've got to be frank that it's impossible to have a complete bubble for Australia. There will be people coming and going, and so unless you put everyone into an extended quarantine every time they go in and out of the country, then you do run the risk of the infection coming back in, and because we're not immune, people will get infected again, and off you go. There's your next wave of infection. So That's the wicked dilemma that we have here. Is that I think that's a worthy goal for the medium term. If we could eliminate the virus in Australia, then that's fantastic. But it's only for a period of time. And what I worry about is what is going to rage around the world, and particularly in countries nearby to us that rely on Australia for a lot of their aid and their support. That if the virus takes off in some of those countries, then it's going to be circulating the world for years and years. So we are an island. In theory we could have an absolutely strict quarantine, but we'd better get used to living without a lot of imports if that's the case.
Yeah, well, I'm going to be talking to Peter Doherty, one of the great immunologists of the world, in about half an hour, a bit under that, actually, just at the top of the 3 o'clock hour. Hopefully he's got some good news on vaccine or treatment progress. Have you got any advice on that front yourself?
Look, only what we received through the AHPPC that's sort of advice to National Cabinet. I mean, I do a lot of reading on these matters. I'm not a epidemiologist. I'm not going to profess to be a subject matter expert here by any means, but there is a lot of information. I'm aware of more than 100 projects around the world looking for a vaccine, but then I'm also aware that no one has ever developed a vaccine for a coronavirus before. So it doesn't mean this can't be the first, and you've got to have hope that with so many brilliant minds around the world, including at the ANU here in Canberra, undertaking this important work, that we've got to have that hope. But at the same time, we've also got a plan for those short, medium and long-term scenarios that see us living with this virus for not just months but potentially years. So how do we re-engineer the Australian economy to produce more output, to have more people in employment, to create more wealth, but to do so in a way that's safe, or certainly safer than our previous arrangements? And that's a question that's before the National Cabinet as well. There are a range of really challenging policy questions that lie ahead of state and territory and national governments as we chart through the next period. But I guess the good news for us at the moment is that we have bought ourselves time. We've done exceptionally well here in Canberra and around the country to flatten that curve. It does give our health system time to gear up, and that's really, really important. And I would much rather be in our position than in the position of many countries at the moment.